Greetings, everyone. Today we're going to be discussing managing physician stress, ways to educate about this type of stress in the healthcare field, and ways physicians can reduce this stress. Did you know? The greatest healthcare crisis American physicians and other health professionals face today is not AIDS, it's not Ebola, it's not heart disease or even cancer. It's an epidemic that very few outside our profession have heard of and that few within can articulate in a way that gives true picture of what we are up against. Let's talk about some statistics about this problem. Each year in the United States, 300 to 400 physicians die from suicide. That's one each day, or the equivalent of 2 large medical school classes. Female physicians are 2.3 times more likely to die by suicide than those in the general population. Male physicians, 1.4 times more likely. What will we learn today about this issue? We're going to discuss why this is important. What can we do about this problem? What do our physicians need to know? And we're going to reflect upon the future and what we can do in support of this issue. So let's first start out with, why is this important to us today? Support. Physicians are at the center of providing care. It's how we give services to our patients. Prevention. We want to help our physicians prevent becoming burnt out, becoming depressed, and having very high stress levels. This issue affects everyone: health science students, nurses, other healthcare team members who interact with the doctors, patients, the quality of care they can receive, and the healthcare culture overall. The list can go on. It's a tragedy, and our providers deserve better support. The second thing we're going to talk about is, what can we do about this problem? There's 4 issues or factors that we can talk about. The first is acknowledgement. The second is changing the culture to seek help. The third is mental health screenings and assessments. And the last would be removing barriers that are present. The first thing we're going to discuss of those 4 is acknowledgement. Destigmatize seeking help. What does this mean? We're going to educate physicians and other healthcare team members so that they understand and acknowledge that these stress levels affect how they deliver care and how they are treating patients and how it affects their overall health. So by acknowledging what's going on and educating physicians and other healthcare team members, that's the first step to providing ways for them to seek help and feel good about seeking help. This will help remove the physician cultural barrier that prevents them from seeking help and care for their own health mentally. The second thing would be change culture to seek help. We want to change how physicians view needing mental health services. So what can we do for physicians? We can provide support groups so that they can talk with other peers or colleagues about what's going on mentally in their lives. Other healthcare professionals, we can educate and identify flags, recognizing burnout and toxic stress levels in their colleagues and providers they interact with. Providing ways and information to refer their colleagues to seek help, or resources they can utilize when they feel it's necessary to have an intervention when they need help or are in high stress levels. The third route we can go is mental health screenings and assessments. This is the way to put a barrier up to prevent and assess what's going on for our providers in our facilities. We can do this by offering mental health services to physicians, mandating yearly screenings that are confidential, and peer support programs where they can sit down and have discussions about what's going on, how they feel, and just an overall feel for talking about and becoming open about mental health and how their job affects their mental health. The key to this is intervention will eventually lead to prevention. We want to prevent physicians from becoming so stressed out that they feel like they have to commit suicide. Lastly, what we can do is remove barriers. We can reduce the intense work schedules of our providers. Being flexible with our scheduling and not scheduling long hours for them will help reduce stress levels when they're working. Assisting providers with the cost of mental health services. We can do this by providing a mental health psychiatrist or resource at the facility they're at and covering the cost of this encounter. High patient volume demands. We know currently in healthcare that we have a lot of patients. We don't have as many providers. So providers are trying to find ways, and facilities are trying to find ways to see as many patients as possible, but it's putting a lot of stress and demand on physicians. Providing resources during non-working hours. We know that second and third shift can be one of the hardest shifts to do, since that's when a lot of high stress environments can occur. Providing mental health resources and screenings or psychiatrists during these peak hours will allow a barrier to be removed so that these physicians can seek help. We're going to next talk about, what do physicians need to know? What's important for them to know about this? Physicians typically aren't taught to acknowledge their stress and instead tend to deny it. Looking back, we can see how a provider may not want to deal with their own stress or own medical issues since they're used to providing care to everyone else. This tells us that one of the things that they need to do is acknowledge their stress, understand that it is present and it can affect their ability to perform their work duties and provide good quality care to patients. The next thing they can do is, once they acknowledge it, is to dissect it. Find out what's causing their high stress levels. What can they eliminate from their daily life to avoid becoming so stressed out that it's toxic to them. This can be done by daily journaling. And where is your stress coming from? Sitting down and just having them think about where their stress is coming from. Is there a schedule they're not good with, like a second or third shift? Is there too many patients that they're seeing? Are they overwhelmed? Just trying to figure out where their stress is coming from. Reflecting on the future. It is important for us to provide this support for our physicians, since if we reflect back to the statistics, 300 to 400 annually deaths by suicide from providers is not good. It's a tragedy. We need to find ways to support our physicians, since they have dedicated their lives to providing care and services to patients, to everyone else around them. Understanding and providing education for mental health and stress management for providers is very important in healthcare today, so that we can address this issue. Thank you for listening, and hopefully this is the first step in educating you and you being able to educate others on reducing stress levels for our providers. Thank you.